Okay, so welcome to our first, our webcast. Basically, what we're looking to do is every day we'll be on around this time, and this is an opportunity to contact the clinic. So you're welcome to either join in with the webcast, or you can email us at our email address is eatonvet@eatonvets.com.au, or you can ask us questions on our Facebook page or email or send them in as normal. Get them into us. What we're trying to do here is basically give people access to veterinary advice, and whether that's about unwell animals, whether it's behavioural issues, whether it's vaccination protocols, basic puppy care, whatever you want to ask, you can get on here, ask us a question, and we'll do our best to answer it. At times when there aren't any people or aren't any questions for us to answer, what we'll try to do is try to cover a topic and explain a few basic things about how to look after your animals and really get the most out of pet ownership. So with this being the first session, what I'm going to start off with is I'm going to talk about a really current topic, which is the seasonal sort of allergies and the skin problems that we're seeing at the moment. So every year around spring or summer, we see a lot of itchy dogs coming through, dogs in particular, but cats can also be affected. And the really classic sort of presentation of these seasonal allergies is the dog, spring or summertime, they start licking their paws, scratching the belly, get ear infections. Those sort of conditions are really the common ones. Now, a couple of things that we really look at for trying to work out what's causing these. Number one is the seasonality, because there's a few other allergies that are going to cause very similar signs. So food allergies, for example, are going to cause the same sort of itchiness. Food allergies are a bit of a tricky one in that in people you expect more acute sort of reactions. In dogs they can have gut problems, but we expect more of a chronic sort of skin or gut issue to go with it. But with food allergies we don't see a seasonal trend, so we really see food allergies, the issue stays around year round. But pretty much probably 90% of dogs that we're seeing with itchy skin at this time of year, it's going to be a pollen allergy. A few other things that it can be, dust mites are going to cause a similar presentation, so paws, bellies, ears. There's also food storage mites, which is something I'll cover briefly in a little while, and that's something you can actually deal with quite easily. So when we get an itchy dog, this time of year, like I say, we generally assume it's going to be a pollen allergy almost until proven otherwise. But what we look at doing is trying to control the problem with using as few steroids as we can. So I think the traditional vet approach has been give them some steroids, send them out the door, ensure the dog stops itching, but steroids can have certain side effects. Now, steroids are necessary in some cases, but they're something that we should be using sparingly, and really only when other sort of more gentle approaches are sort of not working. So what we look at the dog where it's itchy to get the distribution. So like I say, paws, bellies, ears and armpits are your more common spots, so that can occur over the rump or pretty much anywhere they can get itchy with these allergies. We need to make sure that we're controlling anything that's also causing itchiness. So fleas are really your number one issue at this time of year for causing itchiness that you can easily deal with. And fleas, the thing to remember with fleas is you don't have to see a lot of fleas on a dog or cat for really causing a fairly significant problem, especially if they're allergic to fleas. A single flea bite, for example, my old dog that I inherited off my grandparents had quite severe flea allergy, and if I was late buying the flea products, then she'd get a bite and she'd be half bored. It was a really severe reaction, and I never actually saw a flea on her. It was just we knew that it was a seasonal problem, and if I was slack, and I'm just like every other owner, I'm going to mess up and not keep my treatments up to date, should get a bad reaction. But anything that's making the skin irritated at all kind of creates more inflammation and more problems. So we need to control fleas. So the products we look at for flea control, we tend to recommend two main products. Activul is a spot-on product, and that's sort of the new generation of spot-on product. It works very well. It's got a few advantages over the older products. It's more water resistant, so dogs that are swimming on a reasonably frequent basis can have it. They can be bathed with it on a moderately common basis, so up to about once a fortnight. I feel it's still quite effective. It's got a quick kill time, so within about 6 to 8 hours of the fleas getting on the dog, they're killed. That compares to, say, 24 hours for some of the older generation of products. There's very little resistance to it. And you can also get it just as individual doses. So for people who can't afford to fork out for a whole packet at a time, you can just get a single dose. It's a good product, proven very, very effective, and yeah, we're getting some great results with it. The other product that we tend to use is Comfortus, which is an oral flea control product. Now, once again, very, very effective. And the main time we're going to recommend this is dogs with skin problems. So really, what we're looking at, or the reason why we like Comfortus, you can bath them weekly, and we do have, for our dogs with atopy, we do look at bathing on a very frequent basis. And given orally, you can give it when they're wet. There's no sort of restrictions on that. The main thing with Comfortus is it has to be given with food, and they can occasionally vomit when they're giving it. So if you do give a dose of Comfortus and the dog vomits, if you've got it off us, just give us a call and we'll talk you through what to do. But generally they'll vomit after the first dose. Subsequent doses, that vomiting won't continue. So it doesn't tend to be an ongoing sort of issue there. So yeah, that's the first thing you need to be doing if you've got a dog that's itchy, is controlling your fleas. Now, what can happen as a consequence of these allergies, they're not just itchy themselves. What they do is they predispose to secondary infections. So yeast and bacteria can come into the skin, and that's when we start to get a bad smell and also little lumps. So if you have a look at your dog's tummy in particular, if you see little red raised lumps, that's a sign that we've got a bacterial infection, and that needs to be dealt with. And generally antibiotics are going to be the go for those. The ears, have a good sniff of the ears. The most common infection you're going to see in ears is with the yeast called malassezia. So that we tend to get a really kind of mucky blood discharge from within the ears, but you might find that on the external surface all you're getting is an increase in redness, or you can actually get a bit of roughening of the skin. So that's your classic sort of ear infection signs. So yeah, basically have a good sniff of the ears, look for discharge, and look for a roughened surface to the outer ear. And that if you've got those, then we really need to have a bit of a look. Now, another thing that can really be causing problems with ears at this time of year is grass seeds. So if you've got any ear problem, I would say it's worth getting them into the vet really within a day or so, because if you've got a grass seed in the ear, it can migrate in through the eardrum and cause some pretty severe ongoing problems. So dealing with these things early is really useful. Also with chronic infections in the ears, you can start to get narrowing of the ear canal, bigger as it gets swollen, but longer term, it can also fibrose and sort of scar down. And so you end up with a very narrow ear canal, which becomes very, very problematic to manage long term and can actually lead to the need for surgery. So if you've got a sign of secondary infections, really that is the point where you have to get them into the vet, because it won't improve. And quite often these infections account for 70 to 80% of itchiness. So quite often we clear up those infections, come up with a protocol to maintain the skin infection free, and we can basically control things without steroids if we can control the infection in a lot of cases. The next thing we really look at doing is trying to basically help the skin barrier function. Now, with these allergies, what we used to believe is the animal inhaled the allergen, and that basically got absorbed into the bloodstream, formed big complexes with antibodies, and then lodged in the skin, and that's where the inflammation came from. So we used to basically say that be very careful with these dogs when it comes to shampooing, and we don't bath them any more often than we have to, because we used to think that it would remove the protective sort of oils in the coat, and it does remove those oils to a certain extent, but the current theory now is that it's more direct contact of the pollen, so the pollen's are actually landing on the skin and causing a direct allergic response there. So what we need to look at doing is improving that sort of skin barrier function, the oils that are in the coat, and we do find a lot of these dogs with allergies actually have abnormal oils within the coat, or abnormal sort of oily barrier. So we tend to use a zinc and fatty acid supplement called NutriCoat. I use it on my own dog. My own dog's got this seasonal allergic condition, and we find that can work very well in some cases. Other cases it doesn't do a huge amount, but it's all part of our trying to reduce our need for steroids. When my own dog had really bad skin until I got him onto this product, and he's been steroid free for a couple of years now. It can work that well in some cases. Like I say, others not so well, but it's certainly worth a try. And once again, it's all about reducing that degree of itchiness, so we can either avoid steroids or minimise our use of steroids. So that's just given once a day onto food. Very tasty. Most dogs love it. We maybe get the occasional little dog which is a bit of a fussy eater that'll bring it back because they won't eat it. But that's really only a few times a year we're seeing these bottles come back, and we certainly use a lot of it. Now, shampooing is where we've really done a complete flip in the last couple of years. We've gone away from the bath ammonia as frequently as you have to. We're now saying, look, really look at bathing these dogs pretty much on a weekly basis. So what we're doing is we're basically removing that pollen burden that's within the skin, or on the skin. So what I recommend is generally using an oatmeal-based shampoo. So get the whole dog wet, lather the whole dog with the shampoo and leave it on for around 10 minutes or so. Oatmeal-based shampoos are quite good because they leave a bit of a residue and that creates a bit of a barrier function. Leaving it on for around 10 minutes just helps hydrate the skin. Rinse it off and then use, once again, an oatmeal-based conditioner. We use a product called Nutricoat. No, get it right. Nutriderm, and that's basically a leave-on conditioner. So it's got ceramides, which are basically little fatty acid sort of thing, which will bind with water and oil, so it'll kind of help keep the coat nice and the skin nicely hydrated. So that's done weekly using, like I say, using the conditioner as a leave-in. But the shampoo, it's 10-minute soak time on the shampoo. Rinse it off, apply the conditioner, leave it in. Antihistamines have their place as well. Now, probably the best thing to do with antihistamines is talk to your vet and ask them to recommend antihistamines for your dog. Now, antihistamines have probably about a 30% chance of working in a dog, or each antihistamine's got that chance. So you may find you try one, it doesn't do a great deal, try another, and it can become a case of keeping on trying it, and you may find you need to try even 5 or 6 before you find one that really works. Most of the antihistamines we're going to recommend are actually going to be human antihistamines, just because there's very limited animal antihistamines on the market, and sometimes the human ones are actually more effective than the ones that have been produced for animals. So it's all about trying to work out what's best for your dog. Now, dogs which we don't control, or that we struggle to control the skin problems in, we can look at referral to a dermatologist. And something that dermatologists can do very well is something called intradermal skin testing, so they can find out exactly what the dog's allergic to. So what they do with that is they basically sedate the dog, inject small amounts of the things they may be allergic to into the skin, and see what sort of reaction they get over a period of time. And by doing that, they can work out what they're allergic to, and that gives you the option of either removing that from the environment. So particularly if it's one particular plant and you've got that in the backyard, you might be able to go and rip it out. Quite often these dogs are allergic to multiple things though, and so quite often what that leads to is for the dermatologist to basically manufacture a hyposensitization injection for your dog to have, and there's a certain protocol for giving those injections, but for some dogs that can work very well, and particularly the ones where it's not really well controlled with other means. It can be a really useful thing for us to do. There are blood tests that are available to do a similar thing. Now, they're certainly improving and getting better, but we do find that intradermal skin testing is more effective and more likely to give you a really good answer at the first attempt. Now, steroids are something that we quite often have to turn to, and like I say, we try to use these other things as much as we can to minimise our use of steroids. And I guess the way to think of it is almost like an asthmatic. So you have your preventative treatment for asthma, but occasionally you're going to have a flare up and you're going to have to deal with that. So you use things with a bit more punch, and it's a similar sort of thing with these itchy dogs, where if you get a flare up, sometimes you need to have some steroids to bring it under control, or some dogs, all these other kind of things don't do sufficient amount of don't sufficiently control the problem, and so we end up in a situation where we do have to use some steroids. But by doing all these other things, we tend to minimise the total amount of steroids the dog needs. It might mean a shorter course, lower dose, or less frequent use of them. So there's two main types of steroids that we look at. We look at our topical or systemic steroids. Now, systemic steroids, generally for dogs, we're going to use tablets, because what we want to look at doing with dogs is getting them down to every second day dosing. Dogs don't tolerate steroids as well as cats do. Cats seem to tolerate a long-acting injection much better than a dog. And with cats, they're also become more difficult for tablets. So if you get a cat that's easy to tablet, tablets can be a very good thing for cats, but generally most people find tableting a cat on a daily or every second day basis becomes near on impossible. So that's sort of how we look at our systemic steroids. So dogs, we normally start them off on a daily dose, then get them down to every second day, and then we'll try to reduce the dose to the lowest dose that's going to be effective in controlling their itchiness. And sometimes we just need to do that over a month or two while the pollens are at their worst, and then we can back off again and take them off those steroids. Occasionally we'll use a short-acting steroid injection just to really get things settled down while everything else kicks in. We tend to do it a bit of a case-by-case basis, but when we get the bad flare-ups, that's when we need to use the steroids short-term. And then, yeah, but like I say, if we can do everything else to minimise our need for steroids, hopefully, yeah, hopefully we don't have to use them, but if we do, we minimise our use and therefore minimise the side effects that come with them. You can use topical steroids, so there's sprays, for example, that are available, and that can be very effective. It has much fewer side effects than systemic steroids because it's really just working on the skin locally rather than going through the body and affecting the other organs. They're not cheap, those topical steroids, but like I say, they're very effective, and if used well, they can be a really good part of your treatment protocol. Now, that next medication we go on to, you've tried everything else, there's a product called cyclosporin, or we can use it if the animal doesn't tolerate the steroids. I mean, some dogs do get quite unwell with steroids, and that's part of why we try to avoid them. Now, cyclosporin is an immune moderating drug, and there's either a commercial version of it, or we can get it compounded through a compounding pharmacy, and we tend to do that for a lot of our patients because it's quite a lot cheaper that way. And that can work very well either in conjunction with steroids, so using a low dose steroids, low dose cyclosporin, or if the dogs don't tolerate it, or if there's a reason they can't have steroids, then we can use cyclosporin on its own. And once again, we start off on a daily dose and then taper that dose down over several days. So we end up with maybe dosing every 3 to 4 days on an ongoing basis. And like I said, that can work very well as well. Now, I mentioned food storage mites earlier. Now, this is something that we're once again learning a lot about. There was a study that came through in the journal recently, and what that was basically showing is that when a bag of dog food is open, there's pretty much no evidence of mites, but there are various mites that will inhabit dog food or pet food if it's left open, and we find it's pretty much universal. Eventually, these mites will get in there. So food storage mites are one particular mite, kind of a group of mites that you'll find in dog food, and certainly some dogs are allergic to these food storage mites. So things that we recommend to minimise the risk of food storage mites, either basically use smallish sort of bags or kind of out of food, so that you go through them quite quickly and you're opening up new bags on a frequent basis rather than having one bag that's open for maybe a month or so. If you do use one bag, a big bag, try to put it into a sealed container. And once you've finished that bag, give the container a good clean out before you put the new bag in. So try to avoid topping up bags or topping up containers, because that's when you're going to have mites that are living in the stuff that's left behind, and it's very quickly going to grow. They're going to build up into that new bag that you've put in there. Another thing you can do is just once your dog has had its meal, just give its face a bit of a wipe and a clean up, and that's going to just remove any mites that might be around its face, and once again just decrease that sort of stimulus that we're getting from the mites. So that's pretty much the main way we approach these allergies. So running back through it, it's a case of controlling anything else that's annoying the skin or irritating the skin. So fleas, like I say, are your number one thing to control. Look out for secondary infections. So look out for lumps and bumps, bad smell, muck in the ears, those sort of problems. Zinc and fatty acid supplements like Nutricoat. It's an over-the-counter product. You don't actually need a consult to come and pick that one up. But pretty much any dog that's I see with skin problems, we use that. In cats, certainly we can use it as well. Shampooing weekly, leaving the shampoo on for around 10 minutes, an oatmeal-based shampoo, and then rinsing it off, then using a leave-in conditioner, preferably something with ceramides or similar, and that's going to help with that barrier function. Antihistamines, like I say, that's one to really talk to your vet about getting dose rates and find out what's going to be appropriate for your dog. But like I say, generally we're going to actually use antihistamines for those. If we're not controlling things, consider referral to a dermatologist. So that can be intradermal skin testing and then hypersensitization injections. Steroids, we do have to use them sometimes. That's an unfortunate reality of some of these conditions. So using either topical sprays if it's a fairly localized problem, or using systemic steroids if it's quite severe, or if we need to really knock things down quickly. Cyclosporin, if the steroids aren't working, then we have to move on to that. We don't have to do it too often, but we know that option's there and available for us. And yeah, part of that minimising co-irritants is really thinking about those dust mites. So, sorry, the food storage mites. So yeah, popping up bins, using sealed containers for dog food, and then wiping your dog's face as you go. So that's about it for today's podcast. Sorry about the phone there in the background. It's a very happy sounding phone. So if you've got any questions, feel free to join us. We'll be online at 2 o'clock every weekday. If you want to send in a question and then watch this later on either on YouTube or on our website or our Google Plus channel, then you can email us eatonvet@eatonvets.com.au, or you can put the question on our Facebook page or wherever you want to put it, any way you get in contact with us, basically. Otherwise, we'll cover a different topic each day and build up kind of a bit of I guess, a resource of information for clients. So thanks for watching. Bye.